I'd like to know what the fine circular line around my eye socket is called, and what's the best way to erase it.
Thank you for your question. You submitted your question with a photo, and you stated in your question that you want to know what the fine circle around your eye socket is called and how do you go about erasing it. Well, certainly I can share with you how I approach patients in my practice who share similar concerns as yours and explain what the different issues are that cause and create this type of appearance. A little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people with the under eye area has been a significant part of my practice, and I've developed a lot of different strategies to help my patients based on evolution of technology as well as greater knowledge about this particular area. So it is important to have a sense of understanding about what is causing the line and what the options are to improve this. So to begin with, one of the critically important things to understand is that with facial aging comes a significant amount of volume loss. And volume loss means that there is a decrease in the bone structure, particularly in this area. It's the eye socket called the orbit. And the orbit and the cheekbone, the zygoma, are very important in their relationship. So as there is volume loss, there's also loss of fat, loss of muscle, loss of the soft tissue, the fat under the skin, and the skin itself also gets thinner. In a way, sometimes it's referred to as a skeletonization, and you start to see some of the underlying structures. So when you see this line, essentially what you're referring to is an area that's a ligament that connects the skin to the eye socket. And when we look at the area, when we as a physician look at this area, we're not, I think it's less productive to go chasing lines. This is essentially in many ways the gold standard of wrinkle treatment has been to try to, quote, erase wrinkles. And so whether it's with creams or with lasers or even injectables, there's always a chasing the lines. What I think is more relevant, and you can look at people who are considerably younger, is that they have similar issues, but there's an important understanding and balance to facial harmony. And what I mean by that is when you look at your eye, I would say look at the eye and the cheek together. When you look at the eye and cheek together, there are certain things that you can notice. One is you might be able to appreciate that above that line is a little bit of puffiness, which means a little bit of the fat that is normally around your eyes is pushing forward. That's called lower eyelid fat prolapse. Below the line, the cheek volume may be also diminished. And so there is often a strategy that I would recommend with my patients that depending on what they look like in 3D and three-dimension in front of me, which is something I can't necessarily comment on without having that opportunity, is basically you look from different angles. And when I do an analysis in my practice, I take pictures from multiple angles. So patients get a chance to see what they look like from angles they don't usually see when they take a picture. When they take their own pictures, they're usually smiling, they're usually posing. When you're taking medical photography, you're taking photos of faces at rest and with specific movement if those movements are relevant. So opportunities may exist such as the placement of fillers in this area to help improve the valley next to the elevation of the fat pocket in an area where we often refer to as the tear trough to orbital rim area. We can use fillers. Fillers are usually in the hyaluronic acid family. An important caveat is that placing fillers just on the edge there may soften that line, but will it make you look significantly better? There's where I also suggest to a lot of our patients to consider a procedure such as structural volumizing. Structural volumizing is a very specific technique on using a thicker hyaluronic acid filler, such as a Juvederm Ultra Plus or Juvederm Voluma. By placing it at the bone level between the bone and muscle and restoring volume in the cheek, you really create a very natural projection that very often contributes significantly to improvement in the eye area. We have to always think not only specifically and zone in at an area of concern, but look in the face in the whole context and look at facial harmony and balance. So I would say that there is certainly a lot of options beyond just fillers. There are ways to also improve skin quality, be it with lasers or with emerging or significant technologies in regenerative medicine, such as platelet-rich plasma. So I think it's important you meet with qualified, experienced surgeons, physicians who really work a lot in this area, who understand what it is you are concerned about. I find that a lot of patients come in who are essentially unsure on why they went to a doctor, got a filler in the place they wanted, and yet are dissatisfied. And I would argue that it's about harmony. People want to look better. They certainly identify, we all as human beings, we identify certain lines or characteristics. But when you look at the picture more globally, then you can really create a lot more, I think, satisfaction by understanding the relationships that can actually help you look better without just addressing individual lines. So I hope that was helpful. I wish you the best of luck. Thank you for your question.